Dr. Deepak Garg, an eye surgeon. Thank you, doctor, for your time and this interaction. I'm Namita Jain, a wellness professional and a wellness author. Doctor, I wanted to ask you some basic questions on eye care and eye questions. Okay, the first one is, when you're reading, either it's a book or watching a TV or screen, what is the distance that needs to be maintained?
Yeah, so there is no hard and fast rule for this. When you're reading a book or a phone, it will be on the a little closer than a laptop. But a TV can really vary.
Right.
And if the TV is closer or further away, you're not really harming your eyes by changing that distance.
Right.
So I don't think one has to really
bother about the distance.
Yeah, it's not worth the time spent on it.
Okay. Often when one has strained eyes, one tends to put cold packs like cucumber slices, splash cold water on eyes. Is that helpful?
So what we all know for sure is it definitely makes you feel better. Right. So if you do that, there is definitely no harm. What may actually relax the strain or reduce the strain is to look very, very far away for slightly longer periods of time, something that we don't do very often. We are all stuck at near distances. The other is, of course, to close your eyes, right? And the most important, something I tell all my patients is sleep. If you sleep, it's the magic wand and it will basically solve most of your problems.
In terms of diet, we've grown up thinking eating carrots for eyes, good eyesight. Is there anything like that?
So vitamin A is an important part in the function of the retina. Now, if we don't have enough vitamin A, then of course consuming vitamin A will be helpful. On the other hand, if you have enough vitamin A, like you and me, then for people like you and me, if we consume vitamin A, there's no benefit. It's of no use.
So it's only if you're vitamin deficient.
Yes, then it's useful. If you are overstuffing yourself with vitamin A, it's going to basically just pass out from your body, and that's about it. No extra benefit.
So doctor, a lot of people are concerned about spending a lot of time on their laptops. So what is the message you would like to give to them, and they are concerned about their eyes? So any takeaway message?
Yeah, I'll give it in two parts. The first is for children and the second is for adults. Children spending more and more time doing near work, reading a book, phone or a computer, is causing a higher risk of the number increasing. So the myopia or a minus number that they are wearing will increase if you are spending more and more time on the screen, and therefore it's important for children to reduce their screen time. For adults, when you look at the screen, we tend to start staring at the screen. If you stare at the screen, your blinking reduces, your eyes become dry, they itch, they water, they turn red, and it is therefore important to consciously keep blinking your eyes, not to sit under the blast of an air conditioner. Every 20 minutes to look far outside the window for 20 seconds, and these things will reduce the eye strain that you may feel by the end of the day.
This is really useful. I'm sure a lot of people will benefit hearing this. Thank you so much, doctor, for your time and this interaction.
Thank you for having me.